Good morning, everybody. My name is Cristina Sacchi, and I'm the chief of the Autoimmunity department of Alessandria, Sant'Antonio and Biagio Cesare Arrigo Hospital, where the research we're speaking about was carried out. Before starting, I want to thank the SCI Tech Center COVID-19 for the invitation. I want to thank to my team of researchers and clinicians, together with the cooperation of ERC structure. Especially, I want to thank Dr. Camiazzo, Stobbione, and Bonometti. I want to also thank to Autoimmune, because the study was performed in collaboration with Autoimmune Italia, which has supplied diagnostic kits, for example, Lyme blot assays. Moreover, the company helped us with the elaboration of paper results. Before starting, I want to present our study. I introduced to you some slides on the autoimmune disease. What is autoimmune disease? We know that this kind of disease are a group of heterogeneous and different pathologies for presentation severity, with clinical frameworks ranging from a limited affection to an organ to form with systemic interest. Autoimmune diseases are characterized by the defective functioning of the immune system that no longer recognize its cellular and tissue structures, produce antibodies direct against them. Autoimmune disease affect 5–10% of population and include patients of all ages. Autoimmune disease are specialistic pathologies and very complex pathology in the classification. We all know that over 100 different types of autoimmune disorders are known. Today, I would like to discuss about the link between COVID-19 and autoimmunity. Our study aimed to enlighten the autoimmune profile in COVID-19 positive hospitalized patients. Between March 17 and April 6, 2020, we enrolled 40 adult patients, 28 men and 12 women, age 20–97 years, admitted to our Alessandria hospital in northern Italy. All the patients were positive for SARS-CoV-2. The presence of infection was confirmed by RT-PCR on nasopharyngeal swab samples. Why did this idea come out to us? Because out of literature, we know that viral pathogens are known to be one of the most common exogenous factors able to trigger autoimmunity. Specific types of viruses can cause widespread, non-specific lymphocyte BNT activation, promoting the production of autoantibodies and cytokines production. For instance, the presence of Epstein-Barr virus and parvovirus B19 correlates with Hashimoto thyroiditis, HTLV1 and human fomivirus with Graves' disease, and herpes simplex with post-infection autoimmune encephalitis. Moreover, we all know that SARS-CoV-2 infection causes a higher production of inflammatory cytokines. In particular, it has been observed that this immune response can either be helpful to fight these viruses or exacerbate the number of inflammatory chemokines, leading to a process known as inflammatory storm or cytokine storm that could worsen the patient's already critical condition. What parameters did we consider? First, blood biochemical indicators, such as creatinine, LDH, PCR, complement 3, complement 4, ferritin, interleukin 6, lymphocyte number. As to autoimmunity markers, what did we analyze in our study? We used two different techniques, failure technique, and with this kind of method we analyze CTD screen, ARCA, EGA, EGG, and ANCA, vasculite, MPO, and PR3. Our CT screen contains 4 antigens, as you can see on the left margin. We also analyze antibody anti-Saccharomyces cerevisiae. These antibodies are proteins produced by the immune system, frequently present in all those people affected by intestinal inflammatory disease. Antibody anti-Saccharomyces cerevisiae are serological markers of primary importance for the Crohn's disease diagnostics. And finally, antibody anti-Saccharomyces cerevisiae, IgG, can predict the seriousness of the pathology. For what concern antiphospholipid antibodies, we analyzed, using a chemiluminescent assay, the anticardiolipin, anti-beta-2 glycoprotein, IgA and IgG. These antibodies are associated with particular clinical conditions, such as thrombosis or problems connected to pregnancy. They configure the framework table of the syndrome from antiphospholipids. Finally, anticardiolipin, anti-beta-2 glycoprotein antibodies, IgA and IgG, are linked with an increase in the risk of vascular thrombosis and obstetrical complication. On the contrary, with indirect immunofluorescence technique, we observed and analyzed antinuclear antibodies and anti-neutrophil cytoplasmic antibodies. Now I present to you my results we have got to. As demographics, baseline and clinical characteristic of COVID-19 patients, we observed that the age of the patients considered in this study was between 20 and 97 years of age, with a mean age of 60.8 years. Patients included 28 males and 12 females. 11 patients died because of SARS-CoV-2 infection. 30 patients, more specifically all the patients under 60, presented fever at hospital admission. The most common clinical symptoms were dry cough and dyspnea. None of them presented nausea or vomiting, and only 7.5% had diarrhea. 7 patients had one coexisting disorder, but none had a previous clinical history of autoimmune disease. For what concerns radiologic characteristic of SARS-CoV-2 patients, this table summarizes the clinical radiology features of the 36 COVID-19 patients that had RX thorax analysis. Only 4 patients did not require this analysis. Instead, the major part of the patients showed interstitial abnormalities and were above 60 Patching shadowing was also observed in the elderly patients population. Pulmonary thickness were present in our cohort of patients independently of age. For what regards inflammatory status of COVID-19 patients, this other table summarizes the common diagnostic inflammatory markers analyzed in all 40 COVID-19. The patients were clustered about on the age of 60. The analytes such as LDH, ferritin, lymphocyte number, creatinine, PCR, complement 3 and 4, interleukin 6, were evaluating COVID-19 patients under 60 years and having an age of 60 or more. As to autoimmunity markers, this table instead summarizes the number of patients and healthy subjects showing the presence of the most common autoantibodies, anti-NAA, anti-cardiolipin, anti-beta-2 glycoprotein, anti-ENA, anti-PR3, anti-MPO, ANCA, ASCA, IgA, and IgG. Through our research, we observed a significant presence of ANA in COVID-19 patients respect to the healthy population and the patients with ANA and ANCA positivity used to have a still worse clinical course. And now we can reach the moment of our discussion. COVID-19 patients considered in this study showed increased levels of classical inflammatory markers. Patients having high levels of interleukin 6 had the worst clinical outcome. Our data support the concept that high interleukin 6 levels could be useful diagnostic value to identify subjects with a poor prognosis. Moreover, our results sustain that not only inflammation, but also autoimmunity is likely triggered by the COVID-19 infection. All the COVID-19 patients analyzed in our study did not have a clinical record of previous autoimmunity disease at the time of the hospital admission for SARS-CoV-2 infection. The result obtained in this study firmly sustain that COVID-19 is associated with autoimmunity, in particular ANA, ASCA, and ANCA autoantibodies development. In particular, we observed that one of our 40 COVID-19 patients had a peculiar clinical outcome. At the beginning of the hospitalization, after autoantibody investigation, his results were negative. However, his clinical condition was highly severe. He had high critical pulmonary and renal dysfunction, and after 1 month of hospitalization, there were no improvements. Therefore, it was decided to repeat the autoimmune analysis. During the second evaluation, we detected a strong ANA positivity, and the myositis blot was positive for 2 antigens, M2 beta and Q antigens. Therefore, this result support the idea that COVID-19 is associated with autoimmunity, and this is our work. I'm going to introduce another special case to you. As a matter of fact, another patient of our 40 COVID-19 patient and is a elderly patient developed an autoimmune disease, systemic lupus erythematosus. This kind of autoimmune disease is one of the possible chronic rheumatological diseases triggered by COVID-19, and it has been the first full-blown case, as we described in our work, of systemic lupus erythematosus with vasculitis described in literature so far. Our conclusion. This study shows that most of the COVID-19 patients enrolled have an altered autoimmune profile. Our data sustain that autoimmunity is linked to SARS-CoV-2 infection, since none of the patients had a previous autoimmune disease. This is in accordance with what has recently been described in the literature concerning the onset of autoimmune disease upon COVID-19 infection. Data related to patients with a medium severe clinical profile highly suggest that there might be a correlation between the response to SARS-CoV-2 and the specific individual autoimmune response. This could be the reason for the wide variability of clinical manifestation related to a single pathogen. Although the consideration made are preliminary and the study is monocentric, we have definitely started to reveal the link between COVID-19 disease and autoimmunity. Further study using other independent data sets will be necessary to check whether the autoimmune response in COVID-19 patients change based on the disease stages, confirming the clinical laboratory correlation. Moreover, it will be fundamental to perform follow-up at different time points, at 3 and 6 months post-hospitalization, to be able to prove whether the immunological changes that we observe in our population were only transitory, or if the alteration might persist longer and lead to chronic autoimmune disease. Follow-up will also allow the evaluation of the possible effects derived from the therapy used. For that reason, we already obtained the ethics committee's approval to conduct a prospective observational study to evaluate this patient. This research shows, albeit the limitation of the sample size, that the SARS-CoV-2 correlates to an altered autoimmune response. And finally, our results could help clinicians to understand why drugs normally used to treat autoimmune disease may also be useful towards SARS-CoV-2, improving public health. And so, thank you.